Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of 89.3 Lakes FM and Civic Center TV. Civic Center TV on Comcast, Channel 15 and AT&T Channel 99. We're also online in high definition on CivicCenterTV.com. In addition, we're on Birmingham Area Municipal Access. That also is on Civic Center TV, is on Comcast Channel 15 and AT&T Channel 99. In addition, on a couple of other great community radio stations, 88.1 The Biff. That's 88.1 WBFH, a service of the Bloomfield Hills School District with operations out of Bloomfield Hills High School under the leadership of station manager Ron Whittables. WAHS 89.5 Avondale Community Radio also joins us out of Avondale High School in Auburn Hills under the leadership of station manager Marty Schaefer, as well as engineer Keith Fraley and student engineer Logan Pizzuro. Thank them, of course, for being with us each and every day here on the Oakland County Megacast, Monday through Friday from 10 a.m. to 12 noon. Today we're also, as we always are, on Facebook via Facebook Live. Today our Facebook partner is the West Bloomfield Township Police Department, and we thank them for joining us today on the program and serving as our Facebook partner. If you can, go ahead and give them a like. And while you're at it, go to our page on Civic Center TV and give us a like as well, as we bring you the latest information on COVID-19 in the state of Michigan and all throughout the local area, as well as other important news stories, including today's top headlines on CivicCenterTV.com. Michigan reports the highest single-day COVID-19 count in over 7 weeks. On Wednesday, positive COVID-19 cases hit 610 and 11 additional deaths. Total cases in Michigan now stands at 67,237, including 6,015 deaths. This marks the highest single-day total since May 20th, according to Johns Hopkins University. In the United States has surpassed 3 million cases and nearly 132,000 deaths. Michigan hospitals have not reported a significant increase in admitted COVID-19 cases. And Ronnie, you and I talked about this a little bit before we came into the studio today, because it brings up a question now. Obviously, this virus is deadly. This virus is serious. People need to be taking the precautions that they need to be taking place. But we're looking at this, let's call it, for lack of better words, uptick in cases of COVID-19, but we're not seeing an uptick in hospitalizations, and we're not seeing a major uptick in deaths, partly because of, as Dr. Russell Faust and others have explained to us before, the problem age group has shifted from more vulnerable populations to those who are 20 to 29 years old commonly, as far as these new cases are concerned. But it brings up the question of, is this a result of more testing? Is this a result of the younger population being irresponsible that's caused these new cases, or is this a result of decisions that are being made and to be expected, and we need to be monitoring the consistency of this uptick in cases and the hospitalizations?
Well, even Senator Gary Peters that we had on earlier this week was saying that we are going to see more cases because we are doing more testing. So we need to put these numbers into some type of context. We are seeing more numbers, but what is that into percentage of how many more tests we are doing? How many of those positive tests as well are from people that are asymptomatic? I think that would be an interesting thing to understand and to know as well. And how is this happening in some areas but not other areas? How are they doing the contact tracing back to one location versus another location? Every day this is changing. We're learning new things. And I know that the people, that are making these decisions are looking at these things, but I do think that's one of the issues that we need to be mindful of. Of course, we knew there was going to be an uptick in numbers because we reopened, and as people leave their homes, they're going to get out more. And we are also doing more testing. So another issue that we really need to start looking at is the accuracy of some of these tests, because even Dr. Faust was telling us some of these antibody tests are so inaccurate that they may not even be worth the time or your money to get them. And it's a false sense of security. If you go get one of these antibody tests and it says that you're negative, but maybe you're really positive, or it says you're positive when you're really negative. So there's so many questions surrounding this, but decisions are made on data, and your data and your numbers are only as good as the accuracy of the information that you're putting into it.
Absolutely. And about 2-3 weeks ago, we were seeing in the governor's press conference, she had mentioned that Michigan was in one of the group of 3 states in the union that was on track to contain the virus. And maybe that also contributed to these new cases and to some of the incidents we've seen in those weeks as people got excited and said, you know what, we're on track to keep this under control, and we're doing well in the state of Michigan. We don't have to be as severely scared of COVID-19 and can go back to our regular lives, and maybe that contributed. And now, making news at CivicCenterTV.com, COVID-19 modeling now says that Michigan is at a higher risk for an outbreak. COVID Act Now, the national nonprofit group of health experts, technologists, and public policy leaders, has moved Michigan into a category of high risk for an outbreak. It was less than a month ago that this group listed the state as having contained the virus. And now, according to their website, an individual in Michigan with COVID-19 is on average has on average infected 1.14 other people. COVID Act Now has given the state a bleak warning that the number of cases is growing at an unsustainable rate, and if the trend continues, the hospital system may once again be overloaded. But that also goes back to what we just discussed, Ronnie, with in the previous article, that it said that hospitalizations have not seen a significant increase with these new cases. So that's something that you'll have to really monitor, because what was really taxing and caused a lot of the early shutdowns was that our hospitals were way overburdened and not capable of containing this virus and protecting the people of the state of Michigan. So that's where the major concern is going forward, on top of the general public health concerns.
We've seen it, and I will say even I've become a little bit more relaxed when it comes to the hand sanitizer and wiping things down and spraying everything down. It used to be I was washing my hands so much or putting hand sanitizer, they were so dry and cracked. And while I'm still doing it and I carry hand sanitizer with me and I spray things, but I'm not doing it near as often as I was in the beginning. Like, it used to be you look at a surface and you would think, oh my gosh, you touch it, you spray it, you wipe it. So we have all become a little bit more relaxed as we're living with this day to day, and that could also contribute to some of the increase in the numbers as well.
You absolutely have to remain vigilant with this and continue to take those precautions very seriously so that we can keep doing what we have been doing, which we flattened the curve really quickly, and we were able to contain the virus from continuing to spread for a significant amount of time. It was not a short couple of days. It was several weeks. It was a month plus that we were in really good shape, and that was a testament to the effort by the people of the state of Michigan and in our local area here in Oakland County to take those precautions. So we can't urge enough that those continue to be taken, whether or not we are seeing an uptick or not, until this is all over, because ultimately that will help prevent a further spread of this virus.
Right. So speaking of that, would you like a little squirt?
Sure.
So, yeah, just so you guys know, I always have this hand sanitizer with me in the studio here, but it smells really good. It has like aloe and lemon. And so if you're going to do a hand sanitizer, at least get one that smells nice. But I'm always like with everyone around here, I'm like, hey, want some? Not that I think you have cooties or anything.
No. But I haven't been tested either, so it's in an abundance of caution. Other headlines at CivicCenterTV.com. Threats to federal aid draw criticism from Michigan educators. The White House is threatening to cut federal aid if schools do not reopen in the fall, and it has school teachers speaking out against this push. 8% of Michigan teachers surveyed said they would quit or retire rather than be forced back into the classroom if they do not feel safe. Nearly 1/3 of teachers and parents do not feel safe returning students and staff to the classroom without a proven vaccine, mass testing, and reliable antibody testing. Secretary of Education Betsy DeVos and President Donald Trump are pressuring schools across the nation that they will withhold funds to any school district that does not deem it's safe to fully reopen. That a developing story. We'll be able to talk with some more people about that here today and in the coming days as well. But that this issue of federal CARES Act funding going to schools, encouraging them to reopen, has developed into a national issue, not just a state issue or between the states involved in the lawsuit that was announced earlier on this week by Attorney General Dana Nessel and Governor Gretchen Whitmer.
I think one of the things that no one's really talking about with this, what about the parents that have to go back to work, that do need to work? What are they going to do for their kids that have to stay home? Who's going to watch their kids? And if we force remote learning again, and you have more parents that are back at work, are we putting more kids in jeopardy in that side of the area? Just think about it on a regular snow day or a sick day where parents have to struggle for, childcare. I would like to hear from some parents on what their thoughts are on this, because obviously everyone wants everyone to be safe, and you see both sides of the argument, but that can really put a lot of pressure on parents as well.
It will, and it's something that's been on the minds of these school districts. We recently participated in televising a education experience town hall with Representative Brenda Carter's office just in recent weeks, and something that was really interesting that was discussed was from the Pontiac School District. They have been reaching out to community organizations to get out in front of that and say, well, if these parents are going to be going back to work and they're not going to be able to be home with their kids and monitoring their learning and make sure that they're learning, that they're doing their schoolwork and that they are learning during the day and that they are safe, is there a place that they can go that's not going to be further taxing on these families financially in order to be able to provide child care and make sure that these kids are learning without putting them at risk of being in a location that they're around several other people and potentially exposed. So it's something that's on the school district's radar and is on the municipality's radar and the radar of our leaders. And that's an interesting point that you make. It's going to continue to be something that's a major part of the conversation, I would think, in terms of education in the fall going forward.
It's the COVID-19 creativity, because before all of this, if someone would have mentioned, hey, maybe we can partner with the community and these businesses to have them basically monitor our kids during the day, it would have been off the table. So one thing with COVID-19 is it's causing everyone to be creative and to think outside the box. So let's just hope there's some long-term positive solutions that come out of all of this.
Other news, lastly, at civiccentertv.com/coronavirus, Governor Gretchen Whitmer will provide an update on COVID-19 response in the state of Michigan today. The governor is set to begin her press briefing update on the COVID-19 virus in Michigan at 11:30 a.m. We will join that press conference in progress following our 11:30 interview today, but we will also have that in full later on our website on civiccentertv.com. Yesterday, of course, marked the highest single-day count of new COVID-19 infections since May 20th, and the COVID Act Now group, as we reported earlier, has moved the state into a high probability of another outbreak. The Detroit region has been moved into a medium to high risk level, and hospitalization rates for COVID-19 still are, however, remaining flat throughout the state, which is some good news. Expect to hear Governor Gretchen Whitmer, Dr. Jonae Caldoun, and others speak about that. Earlier on the week, the governor did say that if the statistics continue to be murky in the state of Michigan, or if circumstances continue to trend downward, she is not afraid to roll the state back into earlier phases of the Michigan Safe Start plan, or continue to delay moving into the next phase. So once again, it's a call for continued efforts and vigilance on the part of the people of the state of Michigan to take those precautions seriously and continue to follow those guidelines.
Everyone is going to be watching this press conference. A lot at stake here to see what she decides and what's going to come out of this. I don't think she's going to roll us back, but I do think it's going to be tough words and strict warnings, and maybe even getting tougher on some of the regulations and the precautions that are put in place for the businesses that are kind of snubbing their nose at the regulations right now.
I believe a lot of the same. I think that she is going to be very pointed in saying that I don't want to roll us back into phase 3, but we're trending in a direction where it's looking more like the next phase change is going to be back to 3 instead of forward to 5. So if the state of Michigan wants to continue to move forward, we need to take this seriously, continue to take this seriously, and put that effort forward. We're not nearly done with this coronavirus pandemic just yet. And if we let our guards down now, we're going to have a much tougher road forward than we really need to have. We were doing the legwork. We were doing all the right things, and we just kind of have taken our foot off the gas a little bit, it seems. Let's put our foot back on the gas and take this seriously. And if we don't, I'm going to have to make some tough decisions. I would expect a lot of that to be discussed by Governor Whitmer today. That's making our headlines online at civiccentertv.com/coronavirus. You can go there for updated stories on the daily, as well as links to reputable resources from the Centers for Disease Control, the state of Michigan, Oakland County, and many local municipalities. That is civiccentertv.com/coronavirus, or you can go to civiccentertv.com and click on our coronavirus link for all of that information. The COVID-19 pandemic has brought up a lot of new issues in our society and in different communities throughout the local area. And lately, we've been hearing a lot more about incidents of road rage on the streets of Oakland County. And to talk to us about that and how road rage is affecting traffic all around the local area, we're joined by West Bloomfield's Public Information Officer and Deputy Police Chief Curt Lawson with us today on the Oakland County Megacast. Deputy Chief Lawson, thank you for being with us again.
Well, hello, Tyler. How are you? And nice to see Ronnie there in the background.
Yeah, we're doing well. How are you? How are your officers?
Oh, we're doing really well. Everyone's still healthy. We still have our protocols in place here at the police department. We have a really good supply of personal protection gear. And with all the training that we've implemented throughout our department and throughout the fire department, we're staying very safe. Everyone's very healthy.
In the event that we do have further upticks in the virus and that things do return to a point where it's once again very serious, the situation in our local area, are our local law enforcement departments and other emergency services going to have the resources that they need that were a little bit shortchanged before in case of a second wave?
Well, I think we did a real good job during the first outbreak of being prepared, and certainly we didn't let our guard down. So we're prepared. We fully expect to see a rise in COVID cases as we move through the summer. We believe that this is going to be a new way of life for us for at least the next year, maybe moving into all the way next August. So we are definitely making sure that we have the proper supplies and we have the proper equipment to take care of our people so we can keep our community safe.
Deputy Chief Curt Lawson and Public Information Officer from West Bloomfield Township with us on the Oakland County Megacast. You mentioned that the police department and other emergency services in West Bloomfield and in your partnerships with other surrounding areas have not let their guard down. On the other end of the spectrum, you're looking at the people of West Bloomfield and the people of Oakland County, and you're seeing these cases rise. You're seeing incidents in places like Royal Oak that have come from a bar there. You, of course, have the story with the people in East Lansing at Harper's and the spread of coronavirus that was contact traced back to that. So my question for you is, do you believe that the general population is kind of letting their guard down and we're seeing the beginnings of a second wave start to rumble because of that lack of vigilance, maybe, or let up of vigilance, probably is a better way to say it?
From what I'm seeing and from what I'm hearing from the experts, certainly around Oakland County, a vast majority of people are not being complacent. They are wearing their face masks. They're keeping their social distance. But there is a group of individuals, I think it's a minority group, it's not the big group, that are kind of being complacent. They have a false sense of security. They're not wearing their masks. They're gathering in larger groups, maybe going to businesses, certain gyms that are open that should be closed. And those individuals, quite frankly, are putting all of us at risk. So we really need to all be in this together. We need to understand this is the new way of life for us, that we do need to wear face masks, that we need to keep that social distancing. You mentioned earlier that we are currently in phase 4, which means that we were improving, that we were flattening that curve. But I don't have any doubts that our governor, if she sees these numbers continue to rise, we're going to take a step back into phase 3, and we're going to see some businesses and some restrictions throughout the state of Michigan. So if we can all kind of go at this as one, to do what we're asked to do by the experts, we can eventually move into stage 5 and go further down the road in a positive direction.
So we talked about the law enforcement and emergency services compliance with COVID-19 regulations, and you just spoke on how you believe the people of the local area are following these restrictions and these guidelines. What about these businesses? Because they're going to be the ones that will be first immediately affected by a rollback to phase 3 and shutdowns of industries. Are you seeing in your neighboring departments that you've been speaking with, seeing that these businesses are by and large following these guidelines, have measures in place, are enforcing them and doing their best to balance the need for business to be coming in each and every day, but also the need for maintaining the public health so that they can continue to operate going forward?
So I would say a majority of businesses, certainly here in West Bloomfield, are doing what they're supposed to be doing. Those that are not following the governor's orders, we are going out and reminding them. And then there's further down the road here, we have several businesses, very few, but we have a couple of businesses that are just basically thumbing their nose to the governor's orders. We have taken police reports on that, and we have forwarded those to the Attorney General's office and to the Oakland County Prosecutor's office. Because quite frankly, if you just have one business that says, I don't care, I'm going to do what I want, it's really not fair to the other businesses within our community. And it's a public health risk. So we're taking that very serious. We don't want to be out there writing a bunch of tickets, but at some point we're going to have to take some enforcement here.
Curt Lawson with us on the Oakland County Megacast. He is the Deputy Police Chief in West Bloomfield and the Township's Public Information Officer. Deputy Chief Lawson, we've also seen reports of an uptick in road rage incidents on the streets of Metro Detroit, including 13 shootings. What are your thoughts on why this is happening right now? Could the hot days and the stress of COVID-19 be a factor in people losing their cool on the road?
I would say yes to both of that. You've had 12 freeway shootings since June 15th. They're not all related. They've been domestic violence. There's been road rage. So that they're not all tied to obviously one shooter. But I think as you see the temperatures rise, and there was actually a University of Southern California study that said that they analyzed police reports from like 2010 to 2017. And when temperatures reach 85 degrees or higher, you have a 5.7% increase in violent crime. So it's pretty consistent with the data that we're seeing a little bit of uptick in violent crime. I also think with the police reform, the protests we've seen, there's been several law enforcement agencies that maybe have kind of withdrawn a little bit. You don't see them out as much being proactive. So that could play a role, certainly. But people need to understand that this is not just a free-for-all. Law enforcement is still present, and we're still going to hold people accountable.
Deputy Chief Lawson, how do law enforcement agencies like yours deal with these situations? Because they are very heated, and they can at times, as we've seen in recent reports, get violent. What do your officers and other officers in the local area have to be doing in these situations to cool the situation down and ideally resolve them safely?
Well, I'll just say one word to answer your question. That's training. We supply an unbelievable amount of training to our team members here. We give them all the tools that they need to safely de-escalate the situation, to make sure that the suspects, the victims, and themselves, the community, that everyone's safe. So we feel that we provided the tools and the training to get that job done, and I'm very confident in our people to handle those situations as they arise.
Outside of just the situation itself, how is fault determined or wrong determined in the situation? Is the person that was inflicting the road rage on someone else the person that's at fault? Is it both people involved in the incident? How is that ultimately resolved from a legal standpoint?
Well, certainly that's situation to situation. But once you calm the situation down, once we get everyone to bring it down a notch, that we begin our interviews, We look for any sort of camera footage. We interview witnesses, and we try to tell a story. We get that into a police report, and we will forward that to the correct prosecutor's office, and they'll review it to see what charges may be laid in the future.
West Bloomfield Public Information Officer and Deputy Police Chief Curt Lawson with us on the Oakland County Megacast. Deputy Chief Lawson, if someone is in one of these situations where they're falling victim to road rage, what can they do in that moment in the potential road rage situation to try to de-escalate the situation themselves before the police department and other law enforcement is able to arrive and help them?
Well, I think you said it perfectly. They want to de-escalate. You don't want to engage the person. No matter who is at fault, if you cut somebody off, or maybe accidentally cut somebody off, or the other person perceives that you did something wrong, you don't want to engage them. You want to call 911. You want to try to withdraw yourself from that situation. But certainly, we're in law enforcement. We are there to help. So give us a call. Obviously, we will come out and help deal with the situation and de-escalate that situation.
How is your department addressing the defund police movement that's going on right now? What do you want the community to know?
Well, what we want the community to know is that we understand that our community supports us. And it's been amazing the number of people that have called us, that have sent letters of support within West Bloomfield. Our business owners have been phenomenal. And, our residents, our business owners, they pay a lot of taxes. We are somewhat expensive, the police and fire department here in West Bloomfield, but we are providing a very high degree of service to our community. I believe that our fire and police department are really one of the best here in Oakland County, and that's a direct result of the funding that we get. So we provide that training, we provide the education, we make sure that we have very comprehensive policy and procedures in place, and all of that. And you take all of that, and then you make sure you hire the right people, educated people that are diverse, like our community is, and we have a great product as a result.
Do you think this movement may hurt attracting people to law enforcement, especially diverse people?
I do. I think it will. We have to find new ways to attract people to this profession. As we saw during the Great Recession, we saw pensions going away. We saw benefits going away. That hurt us at that time to recruit in law enforcement nationwide. And now that we see that, the law enforcement is in the spotlight, not necessarily a positive spotlight, we're seeing a lot of individuals that were considering having a career in law enforcement, maybe taking a step back and evaluating that. So I think here in West Bloomfield, we need to keep doing what we've been doing for the last 25 years, and that's partnering with our community and ensuring that we are putting the absolutely top shelf product out there on the streets, and that we have a great partnership with our community. So we're just going to keep doing that moving forward. But we had a protest here in West Bloomfield about a month ago. It was an amazing turnout. There's about 600 individuals, teenagers and young adults that came out. And we went out and we met them, and we just simply listened. And that's what's important for law enforcement around the country to do right now, is to listen to the concerns and address those concerns.
And it is important. That is very important that conversation happens. For one, that two, it is taken to heart by the police department and by those that are involved on the other end of the spectrum in the conversation as well. And the police department in West Bloomfield has been very cooperative with the protest that happened about a month ago in early June, and as well as a recent event, the Drive-In for Justice event just a couple weeks ago here at West Bloomfield High School as well. So what is your department doing to continue that conversation? Because one conversation on one day only goes so far, and you know that there are some changes that are necessary or that can be made. A lot of those are already previously in place in West Bloomfield, but in terms of continuing that conversation and working through what changes can be made in this community and be encouraged in others, how are you and your officers and your department continuing that conversation on with the organizers of that protest and other people in the movement?
Well, first of all, you're exactly right that a lot of the changes that they're asking for nationally, we've already have here at West Bloomfield. We have that within our policies, we have that within our training. We don't train officers to do chokeholds, things like that. So I think we're well ahead of the curve on a national level here in West Bloomfield. But yes, you're correct. It's not about having a one-day conversation. The chief and I, many of the executive staff here are having continual conversations with residents, with minority groups within our department to make sure that we are transparent and that we alleviate any concerns that might be out there within our community about our police department. And we've had some great conversations, but we've also, for the most part, done a lot of listening.
Deputy Police Chief Curt Lawson and Public Information Officer in West Bloomfield Township with us on the Oakland County Megacast. Just a couple more minutes with you, Deputy Chief. Anything else you'd like to touch on or that's important for our audience to know before we let you go today?
Earlier you were talking about, COVID-19 and complacency. And I think it's important that with COVID-19 and this new way of life that there's stress. There's stress that goes along with it. And, I would remind individuals that, make sure you have time for your sleep and that you have exercise. And don't forget to take a break from the news media and social media. Just kind of take a time out, spend time with your family. And you know what, if it becomes overwhelming to you, and it has become overwhelming to a lot of people, don't be afraid to reach out for professional help, whether it's through the National Suicide Helpline or Common Ground here in Oakland County. It's just very important that you understand that it's very natural to feel stress, anxiety, grief, worry during these times. So just take care of yourself. And if anything we can do here at the West Bloomfield Police Department or the West Bloomfield Fire Department, obviously give us a call. And, we're there for our residents. We care very much about them, and we appreciate their support.
Well, Curt, we thank you very much for being with us today.
Thank you, Tyler. Have a great day.
Curt Lawson, the Deputy Police Chief and Public Information Officer from West Bloomfield Township and the West Bloomfield Police Department with us on the Oakland County Megacast. We're going to take a quick break, and we'll come back with more. You are watching and listening to the Oakland County Megacast on our family of TV and radio stations.
Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Hi, I'm Dr. Jonae Khaldun. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in our flagship studios at Civic Center TV and 89.3 Lakes FM. Today, we're also, as always, on 88.1 The Biff out of Bloomfield Hills and WAHS 89.5 Avondale Community Radio. That is service of Avondale Schools with operations out of Avondale High School in Auburn Hills. Today, our Facebook partner is the West Bloomfield Township Police Department. We are with them today throughout the program, and we thank you for listening and watching us on the Facebook page of the West Bloomfield Township Police Department and all throughout the local area on our other family of radio stations. Also today on Birmingham Area Municipal Access Television, which in addition to Civic Center TV is on Comcast Channel 15 and AT&T Channel 99. You can also watch the Megacast live and all episodes of the Megacast on CivicCenterTV.com. Alongside Ronnie Dahl in our studios, a lot making news lately in the state of Michigan. One of the biggest stories is what are we going to do in the fall in terms of our children's education. And not only are there concerns, Ronnie, about getting kids back into school in the fall, there's also now concerns about getting teachers back into school in the fall. We recently spoke to Deanna Barish, one of the assistant superintendents in the West Bloomfield School District, about those concerns.
We always are concerned about teacher shortages, particularly in those high areas, so special education, math, physics, those sorts of courses that really are specialized. And so that's always a concern for us. I'm sure that while we've not necessarily seen that in West Bloomfield, we know that there are teachers across the country who are considering their career options at this point in time because it is so taxing to be in education right now and to have all these unknowns and not sure what it's going to look like or how safe it's going to be to return. And so we also are aware we're working very closely with our Education Association leadership to make sure that we have a good joint plan in place and that our staff can return safely. So yes, we're obviously worried about how many teachers will want to come back and feel comfortable coming back. Many have either compromised systems themselves or have someone in their home that might prohibit them from coming back. As far as Lakers Online and that remote learning option, we believe that because these are current students who will be moving from our in-person instruction into our virtual online option, that we'll be able to shift staff to be able to take care of that without any issue. But certainly staffing is always a challenge. And so that's part of the reason for that early deadline, that July 27th deadline, is so that we have enough time to identify teachers, make sure that they get the professional development they need in order to be able to teach remotely for a school year, and then be able to start. Our first day of school is Wednesday, August 26th. So we're on a very tight time frame to make all of this happen.
A lot of things to consider before the schools go back in the fall, and a lot of them, we talked to Bloomfield Hills Superintendent Pat Watson recently about similar topics, and Deanna Barish also mentioning a deadline for parents to say we're going to have our kids in school or we're going to have our kids out of school all together, or we're going to participate in the various hybrid programs that the schools are providing to students in the fall, so that they can prepare for this. And if there is a teacher shortage, they can move staffing around and be prepared to still provide as normal of an educational environment as is possible, or work through filling those gaps should they need to.
In this case, it's got to be such a stressful time to be a teacher, which under normal circumstances is an extremely stressful time as well. And now you're going to add this pandemic on top of that, but trying to get the students to wear a mask to keep them socially distanced. Then what do you do if a student or a staff member gets COVID? How are you going to handle that? Do you then close the school down? Do you sanitize it once again? So many factors and decisions up in the air during this time, which then also puts the additional stress on the parents and the kids to try to make these hard decisions as well.
And on top of that, you have you have teachers that have to relieve their own stress as well, or that they get sick and they have to take days off, and you have issues providing substitute teachers because every school district in the local area needs substitutes on a regular basis in normal times. And in a situation where these substitute teachers are not specific to one school district but are multiple school districts in the general area, they're getting offers each day or several days in a week in various places and may not be available. So now you're worried also about substitute teachers, which makes committing to these programs all that more important and doing so early, which is why these school districts are putting those deadlines in place.
Oh, I'm so glad I'm a pet parent right now, because having these conversations, seeing what the educators, the parents, the kids are all going through is so overwhelming. At the end of the day, this needs to be a conversation not about politics. Let's try to keep the politics aside and make this about the kids and what we can do best for the kids. The good thing about this, and we've talked about this before, is at least this is happening at a time in an area into which we have the technology that we have, because you are able to do remote learning. And so that does offer a different and a new revenue as well.
I think about when I was in school, for the majority of my time when I was in K through 12 school, if something like this would have happened before I was maybe in high school, maybe in late middle school, 7th, 8th grade, we would be in a really tough situation that's significantly worse than this in terms of education. And that's not putting any damper on the situation right now. It's still incredibly serious and challenging. It's going to continue to be for a while. We have Erica Jones with us out in the field now in the Oakland County area. Erica Jones, where are you at?
I need them to. So then, of course, they love her.
Just a moment. We're just having some brief technical difficulties there. We'll get to Erica in just a quick moment. Erica Jones with us out in the field in the local Oakland County area. We'll have her with a guest in just a few minutes. And this education issue not going away at all anytime soon. All other issues that are mounting in the local community on top of that. And Erica's going to uncover that now. She's got her guest out in the field. Erica, where are you at?
Hey, Tyler. I'm at Heritage Park in Farmington Hills on this gorgeous Thursday. It is so hot. We are sweating out here. And I'm here with Jamie, who's the president of Mayfair Preschool Co-op. And she's going to talk with us a little bit about Summer Playdate, which is the program that they run, and tell us what's going on with that. So, hi, Jamie. Thanks so much for talking with us. So just tell us a little bit about the Summer Playdate program and how it works.
Sure. So Mayfair Co-op Preschool, it's a play-based learning center. And we just set up summer playdates for the chance for the families to meet each other, connect with each other. The kids get to interact with each other. The teacher comes up sometimes. So it gives a chance for the children to meet the teacher. And it is play-based. So what's better than play-based than a playground?
Right. And I know it is a really nice program to be able to run during the pandemic because it's all outside, but would you say you've had less kids and families showing up this summer because of the pandemic?
Yeah, probably we've had less this summer. But we communicate with our families weekly just to make sure that they're aware it's still going on. We socially distance. If you want to wear a mask, you're welcome to do so. But we were super excited when the governor opened the playground so that we could still hold this event with everybody.
Yeah, and I know we were talking earlier, you said that in order for kids to come to Summer Playdate, they do not need to be enrolled in.
No, it's no sign up, no enrollment. We just are here from 10:30 to 12 every Thursday, different playgrounds throughout the city.
That's awesome. And do you have the schedule of which playgrounds you're at posted anywhere?
Yeah, it's on our public Mayfair site, our website, or our Facebook page has the Playdate schedule, shows which parks we're at.
Great. And are you here every Thursday, or is there a team of people that work with you?
There's a couple of us that show up pretty regularly. We do have a Playdate coordinator who should be here today, and then the teacher and our assistant teacher occasionally show up as well.
Yeah, well, that's great. Thank you. Is there anything else that you want people to know about Summer Playdate or Mayfair Preschool?
Just come up if you have any questions. If you're interested in enrolling your child, we do have a few spots available. It's a great experience for the kids to have play-based learning and just kind of step into kindergarten and get prepared for that.
Yeah, and are you planning on starting preschool like normal this fall?
We do intend to start as long as we stay in phase 4. We are working on a phase 3 plan if we step back so we can do remote learning.
All right, well, that's great. Thank you so much. We really appreciate you talking with us.
Thank you so much.
Yeah. So as you can see, the kids and their parents are playing outside here on the playground, and it's just a gorgeous day for them to come out and get to meet some of their potential new classmates for the fall.
Erica, are the kids required to wear a mask out there? Are they wearing their masks?
No, the kids are not required to wear masks because it is outdoors and they are practicing social distancing. So if they would like to wear a mask, they're able to, but it's not a requirement.
Erica, anything else from out in the field today?
Nope, that's it. Just definitely a great way to spend your day. And even if you're not participating in summer play date, this park is just beautiful. It's huge. It's a great place for anyone to come outside and spend time. There's nature trails, play areas. They even have a splash pad for kids to play. Great place for a picnic. You can do almost anything here. So definitely a great place to check out.
Well, Erica, thank you very much for that report out in the field. Our Erica Jones with us in the field on the Oakland County Megacast. We'll take a quick break and come back with our next guest. We'll talk about how those with substance abuse issues, those with addictions, are dealing with the COVID-19 pandemic. A tough time for everybody, but it has to be tough if you are battling an addiction. We'll talk about that and more coming up on the Oakland County Megacast.
Hi, my name is Curt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. You can also join us in addition to Civic Center TV on Comcast Channel 15 and AT&T Channel 99 on Birmingham Area Municipal Access on those same two channels. Additionally, we're on the radio, of course, 89.3 Lakes FM, as well as 88.1 WBFH The Biff and WAHS 89.5 Avondale Community Radio. Today, our Facebook partner is the West Bloomfield Township Police Department. We are with them throughout the entirety of today's program, and thank you for tuning in on the Facebook page of the West Bloomfield Township Police Department. So during the COVID-19 pandemic, we've seen various different groups of people. Everybody's been affected by this in some way, shape, or form, and those with addictions are no different. They are being affected by this just as much as each and every other person. And joining us now to talk about some of those issues and how those are being hopefully resolved is Marigrace Randazzo Ratliff, a substance abuse psychotherapist, with us on the Oakland County Megacast. Thank you for being with us today.
Oh, you're so welcome. I'm excited to be here.
So how are you? How have you been during the pandemic?
Well, our offices are busy. In fact, they're predicting mental health will be the next pandemic, actually, because the need is going up so high, and the fear of not having enough, therapists available is a big concern. So right now, everybody's, getting involved in the latest data and trying to prepare to be available for those people who need it.
Do you find that during the pandemic, with the changes that your practice and other psychotherapy practices have had to undergo, that it's tougher to treat your patients because you're not having that in-person one-to-one interaction, or is it about the same or maybe even easier?
I think it's both. I think it's different. And I think what makes it hard is when things are different, you have to go through a transition. And so getting through the transition is stressful. And I think everybody's been hit with so many transitions during this pandemic that it's just been stressful. but we can give people support and help them to understand what is going on with them, because it's the hardest place is when you don't know why you're so upset or stressed out or drinking too much. And the key is to keep educating people on what's going on with them and to not be afraid and to be there for them, whether it's via Zoom, teleconferencing, Doxy, whatever it is, that we are there for them and that people don't isolate, because isolation is at the core of poor mental health.
Just how much of a toll during this pandemic, as people have been stuck at home and they haven't been going out and they haven't been interacting with people maybe as much as they have before, at least in person, in that kind of an intimate situation. Just how great of a toll has the pandemic taken because of that on people, because of that sense of isolation?
Yeah. It's taking quite a toll, because I think people were so shocked and scrambling, and they got, they had to really focus on all the changes they had to make, working from home, losing their job, the family being on top of one another, kids not going to school, those outside structures not giving relationships a relief, individuals a relief, from, going to the gym or not having the kids for 8 hours. When those structures all needed to close and everyone had to come inside, it increased stress and tension in the family and in the individual or in the relationship. And when all these transitions happen so quick, people go into like an automatic pilot and are shocked. And so when that shock wears off, they find themselves feeling stressed, uneasy, uncomfortable, and not quite clear why. And so then they start acting out that stress, whether it's yelling at the kids, yelling at the spouse, getting controlling, medicating, drinking. They will begin to act it out. And everybody's been in the house and on top of one another. So that just keeps getting all of the stress intensified. And so the yelling gets worse, the drinking gets worse over time. In substance abuse, which, is really key to talk about today, and I was so glad you guys were doing this, that isolation it's deadly. It's the worst thing you can do. So it's about transitions for family members, for adults, for kids, that we have to think outside of the box so that we don't isolate and we stay connected with other people. And we not only stay connected, but we vent our stress. We talk about it. And to say to somebody, wow, this pandemic sucks. It just does. And to be able to get it out so that you don't act it out. And that's what has been happening for a lot of people.
And these situations can have severe effects in normal scenarios and in normal times, and they snowball over time if they're not addressed. In a situation like this with the pandemic and all the added stresses that this brings, how much quicker does it take to get to that point of extreme severity where things can make a really murky turn?
That's such a great question, and it's quick now, because as the body, if it isn't dealing with it, if it isn't sharing it, you're absolutely correct. It snowballs and it intensifies. And right now with this extraordinary situation, it's gotten really intense for people. And that doesn't allow you to have very much room to tolerate any little added stresses that are happening to you. And so it's gotten pretty intense for a lot of people. Substance abuse right now is really a serious issue. This pandemic, let me just, quote something that I just read. There's something that's happening, and it's called, we coin it, the term is death by despair. And right now, death by despair is the highest number that it's ever been in history. And death by despair is something like acute alcoholic poisoning events, where somebody has drank so much they drank to the point of death. this is at such a rise and such a serious issue that it is in that category of death by despair. It's not suicide, but it's doing a behavior that is so risky that a person dies from it, or, you know, a person gets seriously hurt from it. And right now, those numbers are so high, and death by despair is the highest that it's ever been in history. So the key here that I really want everyone to hear is isolation is not good or healthy. And talking about the stress and understanding it, that it's real, it's normal. Everybody's going through, you know, low tolerance of stress and frustration, edgy, moody. They need to just vent and complain. It's okay to do that. And if you live alone, you know, get on some meetings, you know, via Zoom, make, you know, time with your supports via Zoom, phone calls. Don't stop the connecting, because that's what's going to help you to stay healthier emotionally than if you just, you know, busy yourself with tasks, which has been a common thing during this pandemic.
What are your thoughts on the state allowing liquor stores to stay open from the beginning stages of this pandemic?
Oh my gosh, that you guys are having great questions. I had a mixed response because I treat veterans. I'm a specialist also in PTSD. And when I treat a veteran who is in a war zone, I don't mess with their coping mechanisms too much during a pandemic. I mean, during a war, because they truly are in a war zone. If we were going to close these liquor stores, we would have to have a plan B for substance abuse to be able to help people for what was going to go on, because not everybody thinks that they're an alcoholic. You know, not enough people understand what substance abuse is. And so if we would have shut them down, we would have had another crisis in substance abuse, in which I don't think the field would have been ready for. I think logically, you know, we go, why would we do that? But being in substance abuse as long as I've been, I had this reaction of, oh my gosh, it would be like heroin addicts not having their methadone. And the clinics just shutting with no plan B, no other supports to say, hey, listen, we've got to be ready for what's going to happen to these people who have a serious physical addiction to alcohol and to drugs. You can't quite see it as a black or white issue. You really have to see it as a gray issue. And it's something that my field really needs to take a look at. As far as, you know, if that were to ever happen, we have to be ready for that, because people are going to be physically sick. The withdrawal that they will go through is very, very serious. And people with stage 3 alcoholism, they are at medical risk. So we would have to plan much better. And our field, I think, is really trying to take a look at that and say, okay, what do we need to do to get on the front lines of what's happening to people?
On the other side of that, you spoke about people in isolation. They need to keep those lines of communication open. They need to be able to vent their frustrations. Yeah. One of the things we're seeing in our society right now is the polarization of politics and the racial issue, to the point where a lot of people feel like maybe they can't have those conversations and they can't talk about some of the things that may be their triggers. What advice would you have for people going through that?
Talking about fear here. And, you know, it's so important to break through it. Don't get so afraid you're paralyzed that you don't talk. When you have to talk about an issue that's really uncomfortable, I teach my clients, say that to start. Say, I want to bring something up. I'm shaky. This makes me feel nervous. but I need to express it to understand it. If I'm stating something that's ignorant, please forgive me for that. I am trying to learn. I am trying to grow and go forward. We have to have the hard conversations, whether it's about substance abuse, whether it's about racism. We have to get uncomfortable to master what it is we need to master. And I teach clients how to master getting uncomfortable, how to master not knowing how to do something. Because that's not the problem. The problem isn't the problem. The problem is how you handle the problem. And so I share with people, having those hard conversations, preface that. Say, wow, bringing this up makes me shake. I'm so nervous. I don't want to offend somebody, and yet I'm struggling with this. Let them know, because the listener then will go, oh, okay, they're starting from a place of ignorance. They're starting from a place where they don't know. And they're going to be more supportive. If somebody does not react, if they come back at you in judgment and come back at you at a harshness, that is not a reflection of you. That is a reflection of their struggle. And so the other part that is so key is don't personalize a person who is insensitive, or a person who has their own ignorance, or a person who is narcissistic and self-centered and judgmental. Don't personalize that and put it in yourself and say, this defines me. Because then you will always walk around afraid to talk. And you don't want to be in that place. You learn who you have in front of you by being vulnerable, having needs, wants, and feelings. You want to know who you're dealing with. And if a person takes that vulnerability and judges you, that defines them. And you want to know that they're that type of person. You want to be aware of that person. And the only way you're going to find out who that person is to have some vulnerability. I think that is so key, is again, to learn how to talk about it, not talk about it or not, to learn how to do it in an effective way. And that is what is so important for people, because we have to start having these really tough conversations in order for things to grow and change and get better. And that's also the key to good mental health, is don't isolate and talk and learn how to get uncomfortable effectively.
Marigrace Randazzo Ratliff, a substance abuse psychotherapist, with us on the Oakland County Megacast on a family of TV and radio stations, including 89.3 WBLD, Orchard Lake, West Bloomfield, Kego Harbor, Sylvan Lake, 88.1 WBFH, Bloomfield Hills, and WAHS 89.5 Avondale Community Radio. That is 89.5 WAHS Auburn Hills. So, Marigrace, on that note, coping mechanisms are so key, but timing is just as key as those coping mechanisms, because if they're coming into play too late, they're not going to be as effective, and if they're not coming in at the right time, they're not going to have the right effect. So in a situation of pandemic proportions, where there's all those added stresses, what are some of these common coping mechanisms that you are helping install in people that you're seeing battling addiction, and those that you are treating that are battling other mental health issues? Because it's going to be different in each of these situations, but there's something relatable to the general public in each of them.
Well, I think, one coping mechanism, especially if you're dealing with substance abuse, is don't stop your meetings. I hope you have developed a community of support that you can turn to, people that get it, that when you start to talk, they're nodding their heads and saying, oh, I got you. I understand what you're going through. And these meetings are on Zoom. These meetings are on the phone. If it isn't substance abuse for you, really get to know, do some homework on self-help and support groups. Of course, therapists are highly trained and highly effective and can help you as well. Good friends, whatever it takes, make sure you're doing regular check-ins every week with people. At least several times a week, you've got somebody, either you're grabbing the phone, you're going to a park, social distancing, talking, venting, define it, sit down and say, hey, I need a, complaint session, and I just want to vent for 20 minutes. I just got to let go of some crap. And then do that, get it out. Second thing, please, and whenever I say this to my clients, I get the eye roll a lot of times, but journaling, and my type of journaling is write as fast as you freaking can. Just write as quick as you can. Get whatever stress is in that subconscious that you might not be fully aware of, just out of it. You will sleep better when you let the stress and energy out of your body and don't keep it in. You will feel better and you will sleep better and you will have more tolerance of children or the wife or the television, whatever it is, the politics. You will then make the space inside to be able to cope better. If you are an overeater, if you are an addict, I say before you walk toward whatever it is you're not supposed to be walking toward, step away, go outside, sit in the car, make a phone call, grab your journal, buy time. The key to addiction is there's an impulsivity problem. And I need everyone to know, slow down the darn pulsivity. There's an adrenaline to pulsivity where you're in the middle of the act before you realize, you drank a 6-pack. You've got to slow the adrenaline down, physically move slower so you can think about what you're doing and then think about the outcome of your choice. This is so key. Those are 3 key tips that I want people to understand. And, self-help books are there. Begin educating yourself. Don't just become a lone soldier with whatever the issue is that you're dealing with, because that will make things much worse. And don't be afraid of finding out what your problems are about. I have this thing that I say, I do a podcast and I say, don't let your crap control you. You take control of your crap and fall in love with it, because you can take that crap and turn it into treasure. Just don't be afraid to do it. And my last tip is watch shame. Shame cycles are really common. You've made the mistake, whatever it is, the blow up, the drinking, whatever it is. You're in this down period after the mistake. You feel like crap. You're beating yourself up. That's the worst thing you can do. Because when you beat yourself up and you're hard on yourself, it then will send you into another spiral to go ahead and act out again. You've got to stop it. You have to say to yourself, you have to be a good parent, I always say. Be nice. Say, oh, okay, you know what? I messed up. I must be going through a lot right now that I did that. The stress must be getting to me more than I thought. I need to talk to somebody. And talk to somebody. Whether it's a hotline, again, AA, Al-Anon, ACOA, which is Adult Children of Alcoholics, whatever the support is you need, get online, Google it, and get the resources to you, because it's not that you're this bad person. It's that you're so overwhelmed, and so many of us are right now. There's been so much negativity and so much hard stuff. It's got to go somewhere. Don't keep it in the system. Get it out.
Marigrace Randazzo Ratliff with us. She's a substance abuse psychotherapist on the Oakland County Megacast. So, Marigrace, on that note, you mentioned a lot of these resources that you turn people to, in addition to being your client or being a client of somebody else. For those in our community that are battling substance abuse and are battling other mental health issues that maybe don't have the ability to connect to these resources online, or be able to get easily to a telephone and make these phone calls, or be able to have access to a psychotherapist like yourself, what can they do in this situation? Because I think it would be, and this is just my own conjecture, it would be a lot tougher for them to deal with these issues than it would be for someone else that has those resources in place.
Yeah. So start talking about it, because when you start to share with friends or people around you, they're going to start giving you connections. Oh, I know somebody. Oh, did you know that there's an AA meeting at the church around the corner? Did you know that there's an Alano Club on Miller in Ann Arbor? Did you know? Start talking to people. It helps. With substance abuse, a lot of their meetings are hosted in churches. Now, they are not affiliated with a specific church or denomination, but they are hosted. Alano clubs, if you ever drive by them, they are key places where they hold all the different forms of support groups. Start to talk, start to be aware. Believe it or not, some of these things, the old school way, are also hanging in the, the grocery stores. They have the bulletin boards. They will post things there. Newspapers, if you still get one, it's the information is there. The key is start talking and asking questions, because you will be amazed. Hairdressers are amazing resource guides, believe it or not. Just start to talk and get connected that way. If you do have the internet, of course, you've got the resources at your fingertips. If you don't, and you feel like, oh my gosh, what do I do? Start picking up, each community has a resource guide, at least it used to. The Ann Arbor Observer used to be, pages and pages of different types of support groups. Get a hold of those guides, because it's all in there. Just get yourself willing to go and look and stop yourself from giving yourself all the reasons why you can't, which is, and this is what I say to my clients, it's crap, people. It's crap. Your mind's doing a number on you, and you got to stop it. So don't be afraid to talk, check, and get yourself connected. And, meetup groups right now are huge. And there's a meetup group for everything, whether it's depression, MS. Hospitals are another great resources. If you call a hospital and say, I'm looking for a support group, if you call any outpatient clinic in your area and say, look at, I'm pretty isolated, I don't have the funds, but I'm looking for a support group, we will share that information and appreciate it. There are hotlines if you're feeling really desperate, suicidal. There's the suicide hotline. Call. Do you know that hotline calls are 10 times what they were before the pandemic right now? That's a lot. But you can call and get help. And I think once you make that step, you are going to feel so much better, a little bit at least. And it will help you to make the next step. So they're going to tell you where the resource is, or if they're on, a phone call, you get on the call. Usually with any support group, they have a key person that is the contact person when you're new to the group. You call and that person will answer, and you say to them, I was so scared to make this freaking phone call. I didn't want to. I was fighting it. Yet I know I have to do this. I'm going to just make myself do this. Number one, they're going to get it. Number two, they're going to connect you with somebody. And don't stop trying.
Marigrace Randazzo Ratliff with us. She's a substance abuse psychotherapist with us on the Oakland County Megacast. Before we let you go, anything else you'd like to say today?
Oh, please, 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 people, don't isolate. And please know the stress is real. It's real for everyone. It is not unusual. It doesn't mean that there's something wrong with you. If you're getting tripped up, so many people are getting tripped up. You are not alone. Don't be afraid. Don't be ashamed. There's a wonderful book called Healing the Shame That Binds by John Bradshaw. I highly recommend it for people who guilt trip themselves or beat themselves up. I hope, they'll check that out. And it can be very helpful, because I think shame and isolation are the two key things that really keep people in anxiety or self-medicating, anything that isn't mentally healthy.
Well, Marigrace, thank you very much for being with us today.
You're welcome. Thank you guys.
Marigrace Randazzo Ratliff, substance abuse psychotherapist, with us on the Oakland County Megacast. We're going to take a quick break and return with more. You are watching and listening to the Megacast on a family of TV and radio stations.
Hello, I'm Dr. Betty Chu, Chief Quality Officer at Henry Ford Health System, and I'm with Wright Lassiter, Henry Ford Health System's CEO, to talk about coronavirus.
In uncertain times, it's natural to have questions. So I'm going to ask Dr. Chu to answer some of the common ones. First, why can't I visit my grandma to see if she's okay?
Because the elderly are at a higher risk for complications with this disease, and you could inadvertently infect her.
If I'm healthy, why can't I go out with my friends?
The larger the crowd you're exposed to, the higher the chance you could get infected and infect others.
If I have symptoms, why do I have to seek care?
While the disease isn't dangerous for most people, for others it can be. We need to understand how serious your case is, because the right choices save lives. For more information, visit henryford.com or call 313-874-1055.
Welcome back to the Oakland County Megacast on a family of TV and radio stations all throughout the local area. I'm Tyler Kieft, alongside Ronnie Dahl in the studios of 89.3 Lakes FM and lakesfm.com, as well as on TV on Civic Center TV and Birmingham Area Municipal Access. Our other community radio stations that are joining us today, as always, are 88.1 The Biff and WAHS 89.5 Avondale Community Radio, two great high school radio stations serving the communities all throughout the Oakland County area. And to talk to us more about the continuing issues that will be faced by school districts and school adjacent organizations in the local area as we approach the fall is Nikki Soares from Kelly Services and Kelly Education, joining us now on the Oakland County Megacast. Nikki, thank you for being with us today.
Thanks, Larry. Good to be here.
So how are you? How's your team at Kelly doing?
We're doing great. I would tell you we're really super busy, if you can imagine. So Kelly Education, we're an outsourcing placement workforce solutions company, and we work across the country in 41 states. And just to kind of give you an idea, we place substitute teachers primarily across the country. Last year, around late 2019, we placed about 4 million assignments. So as we're gearing up, and particularly as we're sort of in the middle of the pandemic and everything that we hear today around the reopening of schools, you can imagine that our recruiting efforts are 24/7 right now.
So there have been recent reports, Nikki, that there's going to be that there may be a shortage of some substitute teachers come the fall. Do you believe that that is going to be the case, and what may be the cause of some of these shortages that may be expected in the fall in our schools?
Yeah, I think that's a really important question. So, you know, it's been interesting. I mean, just to kind of frame it up, prior to the pandemic, you know, we were experiencing just a huge amount of demand in terms of our services. So in our country today, you know, we have a major teacher shortage that was occurring even prior to that. And about 20% of our daily assignments were catering to full-time teacher vacancies that public school districts themselves couldn't fill. So, you know, fast forward today, I mean, when we think about all of our teachers who might be at a certain age or maybe underlying conditions, or even just with our schools anticipating attrition rates, maybe even due to infection, or those teachers that are not able to come back in person to schools because maybe they themselves or family members with underlying conditions, the expectation is we are going to be starting schools with less teachers than what we had prior to the pandemic. So, you know, in my opinion, that's a mathematical certainty that we're not going to have enough teachers to open. And so the demand of substitute teachers, we're seeing it is increasing. Even with our current clients, they're asking for us to sometimes double, maybe even triple our talent pool, simply because they're expecting that attrition. So they want to make sure that in terms of a solution that we bring to bear, that we're able to really help them in terms of anticipating those openings.
So what plans are in place, or what ideas are being discussed now between you and the school districts that Kelly Services and Kelly Education serves to resolve that issue, because if there's going to be a substitute teacher shortage in general, that's not going to affect just one school district. That's going to affect a lot of school districts in the local area.
I will tell you, it's going to affect every single school building in the country, not in Michigan, absolutely everywhere. And so right now, when you think about an outsourced solution like ours, think of us as sort of a co-employer. So, we are right there in partnership, planning on all the logistics, all of the protocols, understanding what's going to be required. And so, it does require us to be a little bit more creative, particularly with space planning, also understanding the credentials of individuals, particularly for those that might need to serve even from a virtual learning perspective, in person, the expectation of where we're going to have sort of long-term assignments, what we can expect on daily absences. Interesting enough, prior to the pandemic, about 8 to 10% of teachers not coming to the classroom every day, whether it was due to a last-minute illness, a scheduled professional development day, a maternity leave, whatever it was, that was equivalent for a student's K through grade 12 career of a full-time teacher missing for 1 year. And so when we think about what we need to do in terms of understanding how we're going to go back to school, we're seeing very hybrid sort of solutions. We've got many schools that probably, I think Microsoft just recently did a survey where they're expecting 60% of our schools across the country will sort of have a hybrid of virtual learning, but also in-person learning. We're also seeing some school districts that are going to go and open wide open 5 days a week, or they might have a combination of the virtual and the hybrid, but maybe they might do sort of staggered scheduling, have longer days for students, but bring them back in batches. So I can also share that many of our schools and districts are anticipating that perhaps some of their logistics are going to have to change. And then, of course, we all know the discussion around masks, around sanitation, hand washing, all of that's going to occur. So it's not only training for our students in terms of how to handle those kinds of environments, but also the adults that are going to be there servicing, whether it's academic teaching or whether they're, in the cafeteria, doing sort of clerical things in the office, depending on what that is. So bottom line is, I think that what we will see, we will have sort of a constant kind of evolution of pivoting in terms of, where infection might be, or in terms of what a specific school building needs could be.
Nikki Soares with us. She is the president of Kelly Education and the senior vice president of Kelly Services with us on the Oakland County Megacast. In terms of getting more talent into your pool and into the substitute teacher pool in the state of Michigan and nationally, there are a lot of different credentials that have to be met by these substitute teachers. In some cases, they are very stringent because you want to have qualified people and people that are safe to be in these classrooms. Even if it's just in the meantime, is there any discussion or any chance that some of these credentials may be loosened a little bit to get more people into that pool so you can fill these gaps?
Yeah. Oh, I think that's a really important question. And I think, we're because of the teacher shortage that we had already experienced, we were sort of seeing the evolution of a workforce model. And I think that if we continue of having very stringent credentials on what we exist now for a teacher, I think that mathematically we're going to see that supply of professionals decline. And there are a couple of reasons. We have less teachers entering the teaching profession. Back in 2005, 10% of incoming freshmen were pursuing an education degree. Fast forward today, you've got about 4.5% of students entering into their underclassmen experience pursuing education. And so to me, this is not necessarily a negative. I do think it's an opportunity to perhaps expand credentials or maybe start that conversation of what we need to do a little bit differently. And so when I think about sort of maybe some of the perhaps a silver lining with folks that have been displaced or find themselves unemployed. So as an example, everybody knows we have a shortage around STEM teachers, and we might have a lot of employees, talent that might have been displaced from STEM careers or within their current jobs. And maybe they might make a great teacher to come into the classroom and maybe take assignments to teach biology or Algebra 1 or something like that. So 4-year degreed individuals that have, basic academic credentials to be a teacher. Another trend that we're starting to see is what we call alternative credentialing. And so we do have organizations within the country that have been certified by departments of education, where they might take in folks that already have a 4-year degree, but if they take an online credentialing course for about 18 to 24 months, then they become credentialed as teachers. So not necessarily going through the traditional sort of career path through college in terms of a school of education to get a teaching credential, but that's sort of another opportunity to kind of take a look at. And so I do think as we sort of progress and as the shortage kind of increases, I do think we're going to be having these conversations more. So we need to be innovative. We need to think out of the box in terms of, bringing really qualified people into the classroom.
On top of just substitute teaching, there's going to be other resources and other services and occupations within these school districts that are going to need to be filled or backfilled as people leave for safety reasons or for other reasons, and as the challenges of schooling children modifies as we go further on in this pandemic. What are some of those other services, occupations, or functions that are going to need some extra help on top of substitute teaching that your service and others are working on right now?
Yeah, another really good question. So I think in every single service line, if you will, within a school building, we're going to see demands. So we're already experiencing like food and nutrition workers, folks that would be working in the cafeteria. Many of our students are on free lunches, so those services never stopped, even during the pandemic in many of our states. So we want to make sure that we have enough individuals there that can cater and prepare meals, and also to obviously to deliver the meals on a daily basis. So also IT support. So as we see many of our schools giving the option of virtual learning, it's going to be critical that we have folks that are there serviced and decked towards infrastructure, network, bandwidth, also able to help with software and other types of online kinds of curriculum support. That's also a really big critical need. Also sanitation. So when we think about maintenance, janitorial services, that's not going to stop. And if anything, and I think we all know that, the opportunities where we're going to have to really clean our buildings more deeply, more often, we need more folks that are able to do that, with various shifts, 24 hours a day. So we're going to see that. Also special education. Our educational aides, our paraprofessionals, who I like to think, they're some of our most unsung heroes. School nursing, that's in big demand as well. And then what's interesting too now, really is the request around temperature takers, folks that maybe can do contact tracing. So we have a lot of that going on right now. And just in terms of anticipating and preparing for the need of what schools might have to do in addition to delivering instruction on a daily basis.
Nikki Soares with us from Kelly Education and Kelly Services. Before we let you go, anything else you'd like to touch on today?
You know what? I think the thing that I think is really profound. So when we talked about our nurses and our doctors and our paramedics, sort of being that front line, the essential workers, our grocery store delivery folks, all of that, I believe substitute teachers are sort of the next line of essential workers. And in fact, anybody that works in a school building, in a school community, will be the next line of essential workers. And so we need to really appreciate and value those folks because I think that they're going to be critical to our nation's success of successfully reopening our economy. So certainly there's a correlation to the reopening of schools, to the reopening of the economy. But the one thing that's going to, I think, prevail in terms of we have to make sure that we're prepared, we're disciplined, and we give the right amount of support to all those folks that are going to be working with our children. So it's important that we get that word out there. So thank you very much.
Well, thank you for being with us, Nikki. We appreciate it.
Yeah.
Nikki Soares with us on the Oakland County Megacast on a family of TV and radio stations. And Ronnie just shows another element of complexity to what these schools are going to be working through and what the state and the country has to work through as we prepare to bring our kids back into schools in the fall. There's going to be a shortage of substitute teachers, and Nikki Soares from Kelly Services and Kelly Education believes that's not going to be just in Oakland County, not just in the state of Michigan. That is on a national level, and we're going to have to get this new talent in place in order to be able to deal with that.
You know what, though? She was such a great interview, giving a lot of information. And also, it could open up new avenues for people. So we've gone through this pandemic, and we're having to realign ourselves and what we do and how we think. So substitute teaching could be this great avenue for people who have that job experience to connect with the kids, to offer them education, but also real life experience as well. So this could be a win-win for people.
I agree, and I think that one thing that I'm thinking of just as a professional in one industry to a professional in another industry is if you are out of work and you're looking for some experience and you're looking for some income coming in, being a substitute teacher with the credentials that you have is a great way to take care of those issues, while also being able to say in future times when the economy does come back and when life does go back to normal, what a great thing to put on your resume and say when the country, when the state, when the schools, when our kids needed somebody to be there to serve this very important function and purpose, I stepped up. And I think that's going to be really critical for people that are out of work or people that can take on extra work, that we need to step up for the sake of our kids. This is, like you've said many times, this is not a political issue. This is a matter of how are we going to educate our kids, and that has to be the focus, whether it's in private schools, whether it's in public schools, no matter what. Ultimately, it's about the children.
We all have a gift to give, and if you are maybe out of work, but you have that life work experience, and to be able to share that with the next generation is such a blessing for not only you because you're sharing your gift, but it's also for them because they're getting a new perspective and a new outlook of possibilities in life. And so we've got to keep that circle giving. It can't end with us. We've got to continue to share whatever talents and gifts we have with that next generation.
We absolutely do. Thank you, Ronnie. And that's not just the only issue that COVID-19 is bringing up. There are a lot of different issues that are still being worked through on the state level and the county level and on the national level. To talk about all of that as it's encompassed by the federal government, we're joined now by one of our state senators. Senator Debbie Stabenow is now with us on the Oakland County Megacast. Senator Stabenow, thank you for being with us today.
Well, I'm so glad to be able to be with you.
How are you? How's your team doing?
We're working hard. I mean, fortunately, staying safe. We do everything remotely, but you wouldn't know it if you call the office or email. You know, somebody's picking up the phone, we're responding. Our team is doing a wonderful job, but like everybody else, we're just having to do it differently.
In the past week and really in the past few days, the new COVID-19 mega issue and battleground issue has been the distribution of federal CARES Act dollars to the education system in the United States. Secretary Devos detailed her interpretation of those CARES Act funds earlier on in the week, and Michigan and 4 other states reacted, filing a lawsuit against the Department of Education,
right,
claiming that this interpretation would unlawfully distribute over $13 billion in aid, and that in effect would support too much the private institutions. What are your thoughts on Secretary DeVos's interpretation of federal CARES Act distributions? Is it beneficial to our schools, or is it hurting our children?
Well, I think the most important thing is it's not what the law says that we passed. And so we want all of our children to be safe. We want all of our children, no matter where they're going to school, to be able to have the support that they need. But what we passed in the bipartisan CARES Act made it very clear that the dollars were going to public schools and were available to private schools based on the number of low-income children in the private school. And so the Secretary of Education changed that definition. So she's just going against what was in the law. So what I'm concerned about is making sure that as all of us want our children to go back to school, parents and children and teachers, and as a grandparent, I know how important it is. Businesses, we can't fully open up the economy if we can't fully open the schools. But the bottom line is it has to be safe, that we can't, jeopardize our children or or teachers or custodians or anyone else in the school. And so that's why I'm working and have developed a bipartisan bill that would provide the critical finances needed for the schools to be able to do all the things they need to do to make sure they can open safely.
So this bill you are working on, Senator Debbie Stabenow with us on the Oakland County Megacast. It is a bipartisan bill. You've been working on it with Senator Bill Cassidy of Louisiana. In addition to the Federal CARES Act and other programs at the federal level that are helping our schools, how would this bill specifically help our schools across the nation?
Well, in Michigan, we know that to be able to safely reopen schools, in total, there's about a $1 billion cost to do that. The national superintendents say it's about $1.8 million per school district, some more, some less. So this would provide the funds for what we now call PPE, personal protective equipment. It would provide the funding to help change the configuration of classrooms so you can do social distancing. And when you do that, that means you need more classrooms. It may mean, you've got to take other rooms and reconfigure them to be classrooms. And when you have more classrooms, you need more teachers and you need more custodians and sanitary equipment. And a school may need a better HVAC system for ventilation. There could be a variety of things. To me, it's providing as much flexibility as possible for local schools to do what they need to do that works for them and for their children in the schools. And so this is a bipartisan bill. House already passed a bill with significant funding. Actually, 55 days ago, they passed what's called the HEROES Act. It's been sitting in the Senate. Senator McConnell has not chosen to bring it up yet. He said he didn't feel a sense of urgency to do that. But boy, do we feel a sense of urgency. And, in my own family, my son and daughter, when they look at their children and they feel a sense of urgency, and teachers and business people and so everybody understands there's not only a sense of urgency about opening the schools, but the timing of the resources. We should have already passed this bill because the schools need time to be able to do the things to physically make the changes or to hire additional staff to be able to operate safely. So the Senate's not in session now for 2 weeks, and I just think it's really it's really terrible that we're not even going to be able to try to address this until the week of July 20th, and then my guess is nothing happens till the end of the month or beginning of August, and I think that puts parents who are just trying to figure out what to do, and schools trying to figure out what to do, puts them in an extremely difficult situation. And it's very unfair that that's the case. So we're trying to do as much as we can. I just got off a phone call with 100 superintendents across Michigan, Zooming away. And we talked about what their needs are, how they need those resources right now so they can make the best decision. They all want to reopen. We all want to reopen. But right now, in the middle of a health pandemic, we've got to make sure our children are safe.
Between the Federal CARES Act funding that would be going to our schools across the nation, on top of that provides funding that is critical to their operations and will certainly help to bridge some of the gaps in budget cuts state to state. The HEROES Act would just be that much more. How much more does the HEROES Act help on top of those to not only make this more functional for the financial struggle, more functional for these schools, but maybe help them alleviate some of the major issues that come along with that?
Sure. Well, we're looking at, it's estimated nationally that in order to do K-12 schools plus community colleges and universities, it's upwards of $75 billion across the country. The HEROES Act put in something slightly less than that for K-12. So I think I would like to see that number be more around the national number of 75 billion. And that's what our chair of the Health and Education Committee is suggesting might be the number. We don't know for sure, but it needs to be enough to really make sure there's confidence that our children are staying safe. But in addition to K-12, we know there's somewhere, we understand from our colleges and universities, somewhere between $1,000 and $2,000 per student that's needed to address the extra costs and changes around dormitories and cafeterias and classrooms on college campuses and other issues that they need to address on distance learning and so on. So there are additional costs. And the problem is, and I'll just speak for us in Michigan, the problem is, of course, the economy has been down because businesses have had to close to address the pandemic and safety issues and so on. So that means there's less sales tax coming into the school aid fund. There's less dollars available. And we're looking at a huge deficit this year and next for our schools. I mean, understand that that's the case, but it doesn't magically go away. We have to figure out what to do. So that the state right now is taking some dollars and to help the schools, knowing that but they've also been having to do cuts, and they'll have to do more cuts if the federal government does not step up and be the partner that we should be. States and local communities were told at the time this all started that they were the front line. They needed to act, that there wouldn't be a national response, that the states had to act. And we all assumed that meant the federal government was going to have their back and that be able to come in behind with flexible money for the state, for the cities and the counties and the schools. And because there's not been a willingness to do that, the administration has not yet expressed a willingness to do that, and certainly Senator McConnell has not in the Senate. We're in a situation now where folks that were operating in good faith to try to save lives and protect all of us are scrambling now, and it's going to end up in layoffs of people in Michigan, which we don't need more layoffs right now. We need fewer, and reduction of services, well, it's whether it's first responders or public health or laying off teachers and bus drivers and custodians and all the other 911 call centers, I mean, whatever it is, all the public functions we have, food inspectors, I mean, all of those important public functions. And the federal government needs to act and play an important partnership role at minimum. I mean, I think there should have been a national federal response in the beginning, but if not, if the states were told to step up, then the federal government has a responsibility to be a partner. And because that hasn't happened yet, all those cuts, it's like the trickle down cuts are now happening, and they end up in our schools with cuts in teachers and other important services that our children need.
Senator, if I could shift the conversation just slightly, you've been in politics a long time. Following 9/11, that crisis seemed to unify our nation. We are in this period right now where politics seems to be so divisive, and this pandemic seems to be highlighting the divisiveness in our country. Number one, how hard is that as an elected leader to try to come together in a bipartisan sense to get things accomplished? And how do you think this is going to impact the upcoming election?
Well, Ronnie, that's a really fundamental question, right? And first of all, I work across the aisle every day. That's how you get things done. It is much harder in this environment when we have a White House, frankly, that does not value that and actually tries to step forward and attack and punish people in their own party when they work across the aisle. So it has made it much more difficult. When you think about 9/11, I remember that it's burned in my brain. I think yes, for all of us. I was, 9/11, 2001, I was coming in my first year as a United States Senator. And I remember how we all came together, and President Bush stepped up and we all supported him. And I remember standing on the Senate steps, all of us came together that evening after that horrible, horrible attack and wanted to show that we still had a functioning federal government, that we were still together as a country. We stood on the Senate steps, Republicans and Democrats, and one of my good friends started singing God Bless America. It was just very impromptu, but we all ended up doing that. It was an incredible experience, inspiring moment where everybody started singing God Bless America. So we can do that. We want to do that. But there's really just, it's actually pretty simple, the reason it's not happening. And it really does start at the White House. We have a president that doesn't value that at all. And he views it as, somehow he benefits by having everybody divided and blaming each other. And boy, is he wrong. So I'm going to continue to work across the aisle and do everything I can. But instead of all of us working together and standing together and having a national strategy and saying to everybody in the country, boy, we know this is a pain. We know that wearing a mask is a pain, and not seeing grandpa and grandma or being able to hug each other like we want to is a pain, and all the other things that have happened to the economy. But you know what? This is the plan, because it's the only way we can deal with this. And the quicker we do it, the quicker we get past it. That's what's happened in every other country. I mean, we're in a spot where we're 4%, a little over 4% of the world's population. We have about 25% of the world's cases and deaths. Now, that should not be in the greatest country in the world here, where we have all this expertise. It's happening because our country didn't start in January like everybody else. There was no national strategy. There was no national testing. It was one case and everybody said it was going to go, the White House said it was going to go away. Well, it didn't go away. It didn't go away anywhere. We just got 3 months behind and haven't had a national strategy on protective equipment and what we need to do to make things here so we're not dependent on China or anywhere else. And we're paying a price. We are paying a heavy price for it. So, I'm doing everything I can. We all are trying to figure out, how do we deal with where we are? Most important thing is keeping people safe and saving lives and addressing the economy. It's both. People are being hurt economically and hurt in terms of the pandemic. Problem is, you can't address the economy unless you get your arms around this health pandemic. And so it's got to be both. And schools are really at the heart of this, I believe, right now. And so that's why I'm focused on how do we do this safely.
Senator Debbie Stabenow, thank you for being with us today.
You're welcome. It's good to be with you.
Senator Debbie Stabenow with us on the Oakland County Megacast. We appreciate her taking the time to join us today and thank her for her time as well. We're going to take a quick break. When we come back, we will go live to Governor Gretchen Whitmer, who is speaking from Lansing. That coming up on the Oakland County Megacast. We will join that in progress after this break.
Michigan, we still need to stay careful because we don't want to go backwards. Back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft in the Lakes FM studios alongside Ronnie Dahl. We'll now go live to Lansing as Governor Gretchen Whitmer is addressing the state in a press conference. Currently speaking at the lectern is Lieutenant Governor Garland Gilchrist II. We will go now live to Lansing.
To connect people to primary care and other services and programs as they await COVID-19 tests or test results. This is not something we can solve overnight, as I said before, but we must do something right now because more and more lives are still being lost here in Michigan and everywhere around the country. The task force is diving into more issues, such as expanding internet access for safe delivery of a wide array of medical and other services. We're looking at how environmental factors, such as air pollution, must be addressed to improve resilience to COVID-19, but also to improve overall health outcomes. And we're taking a broad look at how state tools and programs can be refocused and optimized to address and overcome the systemic racial injustices that have baked inequality into the reality of too many Michiganders. This is our generation's opportunity to confront and right historic wrongs. Doing so will not only enable us to survive COVID-19, but in the name and the memory of those who we've lost, we can design new systems that truly serve all of our communities. That is our mission, and that is our charge. And with that, I'd like to thank you all for being here, and I would now like to welcome Dr. Jonay Khaldun to the podium for an update.
So good morning. Thank you, Governor and Lieutenant Governor. As a Black woman and a practicing emergency medicine physician, I'm proud to stand here today with Governor Whitmer, Lieutenant Governor, Director Orleen Hawks, and as a member of the Racial Disparities Task Force to announce the Governor's executive directive for implicit bias training to be a part of healthcare professional licensure requirements. We've seen, as has been discussed today and many times, the disproportionate impact that COVID-19 has had on people of color in Michigan, and particularly Black people. Black people have been disproportionately infected by and are dying from COVID-19 in Michigan and across the country. This is the sad truth, but it's in no way a surprise. Black women are 3 to 4 times more likely to die from a pregnancy-related condition than a white woman. A Black baby is 2 to 3 times as likely to die before their first birthday as a white baby in the state of Michigan. Healthcare disparities and inequitable access to opportunities to be healthy are unfortunately something that has existed in this country for centuries. These disparities cannot be explained simply by differences in skin color or genetics. A disproportionate number of people of color live in poverty due to historically discriminatory policies in this country. And during the COVID-19 pandemic, this means they've had to disproportionately leave their homes to go to work because they were deemed essential. People of color are more likely to live in multi-generational homes or crowded housing, where isolation and quarantine are more difficult to do. And there's data that shows, as we've discussed, that implicit bias exists, and it has an impact on the quality of care that people of color receive. Whether it's not offering the same treatment plan, dismissing a patient's complaints, or not being sensitive to cultural differences, implicit biases absolutely show up in medical interactions and it can lead to negative health outcomes. So this implicit bias training is a simple but impactful way that we as healthcare providers in Michigan can strive towards being a state where, regardless of where someone seeks medical care, a dentist's office, a pediatrician's office, an optometrist, or an emergency department, clinicians are aware of the biases they may have and they have the tools necessary to address them. And I look forward to working with Laura Director Orleen Hawks on this important effort. So now let's talk about where we are with COVID-19. So as of yesterday, Michigan had 67,237 confirmed cases of COVID-19 and 6,015 total deaths. Yesterday, we also announced 610 new cases, the highest number of new cases reported since May. Cases have been increasing overall in the state for the past 3 weeks, with some areas seeing higher numbers than others, and I'll go through that now. So the Grand Rapids region has had 3 weeks of increasing rates of cases, and they now have 45 cases per million people per day, the highest of any region in the state. The Detroit, Lansing, and Kalamazoo regions all have over 20 cases per million people per day, and the Traverse City, Jackson, and Upper Peninsula regions all have under 20 cases per million people per day, but they have also all seen a steady increase in cases for the past 2 to 3 weeks. It's important to note here that the Upper Peninsula, which had previously seen consistently low levels of cases, is now seeing the highest rate of cases seen throughout the entire pandemic. So our local health departments, as I discussed before, they continue to work diligently to respond to these cases and investigate outbreaks. So some of the locations associated with these outbreaks include food processing plants, bars, a casino, religious gatherings, and congregate care facilities. But there's also evidence of general community spread. So far, our hospitalization and death rates have not increased. But to be clear, what we have seen in other states is that hospitalizations and deaths tend to increase several weeks after the cases are identified. So we still have to watch this data very closely, and it's very likely that these numbers will go up in the upcoming weeks. But the good news is that we are continuing to increase our testing across the state. And over the past week, we actually had an average of over 18,000 tests done per day. And that's actually 3,000 more tests than the previous week. Michigan's now testing more than we have throughout the entire outbreak. But this is not the only reason for the increase in cases that we are seeing. The percent of tests done that are coming back positive has also slowly increased from 2 to 3%. And what this implies is that we are also seeing increases in cases because there's true spread of the disease. So right now, the data is not looking so good. While we are certainly not in the extreme situation we were in this past spring, we really do need to get back on track and in the right direction again. And we all have a role to play. So please, as the governor said, wear your mask if you are leaving your house and going to a public space. You're not only protecting yourself and your loved ones, you're protecting the lives of our frontline healthcare workers, the heroes and sheroes of this pandemic, who every day are risking their own lives to take care of patients. Maintain 6 feet of distance between yourself and others and do not gather in large groups. Several of the outbreaks that we are seeing across the state are because people are just not being smart about this and they are taking unnecessary risk. As we fight a resurgence in cases, continued expansion of testing will be critical to rapidly identifying cases and containing the spread of COVID-19. And we still want everyone who needs to get a test to get a test. So if you're working outside the home, I'll say this again, if you're working outside the home, if you're interacting with people outside of your household, you should get tested. If you or someone you've come in close contact with is sick, you should get tested. And you can go to our website at www.michigan.gov/coronavirus test to find a site nearest you. And you can also, because of our partnership, call 211 and they can help you get tested as well. Contact tracing is also one of our most important tools we have during this pandemic, and I've talked about that before. Our local health departments have worked tirelessly to investigate every COVID-19 case and identify who they may have come in contact with. So every time we identify a positive case, our contact tracers have been successful about 80% of the time in making an initial attempt to contact someone within 24 hours of identifying that positive test. We are successfully able to reach someone, meaning that they actually pick up the phone when we call, about 60% of the time. So we've made great strides in building a team of contact tracers, over 10,000 volunteers that have signed up to assist, and hundreds of paid staff across our local health departments who are making these calls every day. But our greatest challenge right now with our contact tracing is that our public health staff often do not have the correct telephone number, or people who we are calling are simply not answering the phone. So I can't express enough how important it is for you to give healthcare providers accurate information at the time you're getting a test. And if someone from your state or local health department calls you, please answer the phone. If you've tested positive, it's important that we understand who you've been in contact with, and we may be calling to tell you that you've been exposed and you need to get a test or you need to quarantine. This is such an important part of our strategy and how we'll slow the spread of the disease. So Michigan is in a different place than we were a few weeks ago. Cases are rising, but there is still time for us to keep this curve down and not see the resurgence that we're seeing in so many other parts of the country. Wear masks, don't gather in large crowds, and wash your hands frequently. Do it for yourself, do it for your loved ones, and do it for your community. I think we can beat COVID-19, I know we can, but it's going to take everyone working together and doing their part. And with that, I'll turn it over to Laura Director, Orlean Hawks.
Thank you, Governor, Lieutenant Governor, and Dr. J for your leadership on this critical health issue. A key part of the mission of the Department of Licensing and Regulatory Affairs is to protect people. COVID-19 has brought that mission into clear focus as we continually work to protect those who rely on our licensed health professionals. Our department is grateful to be a part of the implementation of this executive directive to expand that protection even further. Likewise, it's been an honor to serve on the Michigan Coronavirus Task Force on Racial Disparities, a wonderful, insightful group of people dedicated to making recommendations in real time to reduce the immediate risk of exposure and disparate mortality rates of COVID-19 on communities of color. While the work of the task force is far from over, Laura is ready to begin the process of working with Michigan health professionals to confront this issue head on. Our department licenses and regulates nearly 2 million entities and individuals. This includes 26 occupations which are governed under the Public Health Code and corresponding administrative rules. Our role as a state agency is to ensure that licensees are adequately prepared to practice their occupation in a manner that upholds public trust and safeguards public health, safety, and well-being. Accordingly, we are committed to working with our respective licensing boards to establish new rules requiring all healthcare professionals to receive training on how to recognize and mitigate implicit bias. This truly will be a collaborative endeavor that is purposed to enhance the knowledge base and skills necessary for health professionals to be licensed in this state. I have full faith in Michigan's healthcare workforce. They are as dedicated a profession as any, and we are proud of the world-class care that they deliver every single day.
We interrupt the governor's press conference. It is the top of the hour. We are going to conclude today's edition of the Oakland County Megacast. We will see you again tomorrow.